Hello, Nur.
Hi.
Very nice to see you.
Very nice to see you too.
I recently had hyperbaric oxygen treatments in your clinic.
You did?
It was a great experience. It was very relaxing and I felt really refreshed afterwards and I had the best sleep. And if it's okay, I want to ask you a few questions about hyperbaric oxygen treatments. When I was at medical school, we actually had a department for this and we saw lots of patients with different needs going through the treatment and getting a lot of benefit from it. But that was a while ago and, a lot of things have happened in the field and it would be nice to kind of have a discussion about where things are with hyperbaric oxygen treatment at the moment.
Of course.
Maybe it's good to start from maybe you telling me about what hyperbaric oxygen treatment is.
Of course. Hyperbaric oxygen therapy is a specialized oxygen treatment that involves breathing pure oxygen in a pressurized hyperbaric oxygen chamber.
Mm-hmm. And how did you get involved in this field?
Oh, yes. So, well, as you know, and I have worked in accident and emergency for quite a number of years. I was mainly in acute medical environments and intensive cares. And so then I have moved to pediatrics and I became a consultant in pediatrics. And then I further specialized in pediatric nephrology. And so from on a personal level though, I suffered from chronic migraines myself for years and years, more than 20 years. And because I had I would say minor head injury, I had a fall and then I was told that I had a concussion. Unfortunately, my concussion symptoms never ended in a way. It sort of it changed in the form, but I have then sort of ended up with having with chronic headaches and turned to migraines. And I used everything under the sun to manage my migraines and headaches whilst I was training at the same time as well. Then after some time, I started looking for root causes. And then I started conference hopping and I studied integrative medicine in USA after finishing my studies in the UK and I became a consultant in the UK. I've done quite sort of number of courses in integrative medical field. And through my integrative medical training, and I came across with hyperbaric oxygen. And also, like, I sort of was made aware of the hyperbaric oxygen medicines emerging indications as well. As part of this, that I realized that hyperbaric oxygen therapy was used for acute and chronic concussions as well. So then I became interested, and it played a significant role in my last bit of healing. And then also I then used this on a sort of family member who suffered from neurodegenerative disorders. And then when I realized it is such a powerful treatment and a natural but powerful treatment, so I became more intrigued and interested, and then I have trained in hyperbaric oxygen medicine as well. And then realizing that at the time when I did my all this sort of further training in hyperbaric oxygen medicine, so I was just looking for a medical sort of hyperbaric oxygen clinic, and it's with the medical grade chambers. And then I realized that the only place was in Whipps Cross Hospital, but they had they are mainly treating wounds. And difficult wounds and decompression illness. So realizing that that there's a need, so I have then opened up hyperbaric oxygen clinic in London. So we've been I've been involved since 2019. So this is how I became involved.
What an amazing personal story that you have, really. That actually it started from a personal experience, and then you've explored how it's being currently used and took it from there to think about expanding it because it's an emerging field. We're going to talk about that too. Maybe we can start from the process of somebody coming through your door or contacting you, either referred by another specialist or someone who wants to try it out. What do you do? What's the next step? Can you talk me through the process?
Of course. So we do have a lot of referrals from consultant colleagues. So So my job has been a medical director of NUMA. So I go through each and every single inquiries made to NUMA for hyperbaric oxygen therapy, for us to understand whether it is an appropriate indication, whether it is safe for the patient, and also whether it is whether hyperbaric oxygen, there's a rule for hyperbaric oxygen therapy on a referred patient's management. So they fill out questionnaire, online questionnaire, and so we sort of very focused on hyperbaric oxygen, of course. So we just make sure that it is appropriate, and we also just make sure that it's safe for them. So I go through everything and their medical history based on the questionnaire. Then I meet patients and they have the examination if necessary, and then we assess and we do the vital signs and we make sure that they are okay to go and have hyperbaric oxygen therapy. Then I also, that also gives us an opportunity for me to have a discussion and with the patients and explain the potential benefits, side effects, limitations, and also what to expect. And we also talk about the available medical evidence in research papers, and also we talk about the limitations, and then we just take it from there.
Brilliant. So they're thoroughly assessed, really, and very well informed, and you give them lots of space to reflect on what they heard, which has been my experience as well. So that's wonderful. How about the traditional implications, like kind of going back to when I studied at medical school?
Of course.
Shall we start from there, and then we can think about the...
Yeah, of course. So there are like 350 years plus history with hyperbaric oxygen, but therapeutically it's been used for the last 50 years. But main traditional indications are sort of like mainly decompression illness, carbon monoxide poisoning, difficult wounds, the osteomyelitis, the bone infections that doesn't heal, cerebral abscesses, sudden hearing loss, sudden visual loss, arterial gas embolism, and the list goes on. So it's essentially is more on life-threatening emergency conditions, including like severe anemia if the patient can't have blood transfusion. And so these are the areas that hyperbaric oxygen therapy has been traditionally used.
Mm-hmm, mm-hmm. How about patients coming through your door? Mm-hmm. I mean, what kind of patients do you see nowadays? Apart from, the traditional implications, what other types of clinical presentations do you see in your clinic, and what's been your experience?
So we don't treat open wounds in NUMA. So we don't do any emergency treatments like decompression illness. So we do accept patients with some of the indications from the traditional use, like sensorineural hearing loss. But the rest of the patients usually we do have plastic surgical colleagues, and they refer their patients after surgical treatments and surgical procedures being done to speed up the healing process and to reduce the swellings and edema and bruises, and which seems to be very useful, very sort of helpful, and speeds up the healing process. We do have quite a number of patients attending to speed up the post-surgical recovery. And I am very passionate about acute traumatic brain injury and chronic concussions. And so we have a number of patients come in with acute concussions. Obviously, they have their assessment. They are sort of assessed in accident emergencies. And they are sort of, some of them just obviously, as indicated, they have their CT scans, and then, but they have chronic concussion symptoms. And those patients do come, and then we offer them we accept them, and so we offer hyperbaric oxygen therapy. And we also have quite a number of patients with chronic concussion symptoms, like myself. That was the sort of how I found hyperbaric oxygen. And then we have a number of patients attending with long COVID, and so chronic fatigue. Some patients when it is appropriate, and then we do have some referrals from consultant colleagues. And so these are the main group of patients that come in, and inflammatory conditions. And we had successfully helped quite a few patients with inflammatory bowel diseases, Crohn's disease, ulcerative colitis. But it's important to know, obviously, we're not suggesting that it should be replacing conventional treatment whatsoever. And these patients do come through their consultants, or they self-refer themselves, but we go through the assessment and then we collaborate and then work together with the consultant colleagues and who are actually managing the patients. But these are the main group of patients attending to NUMA for hyperbaric oxygen.
I think it's also important to say you work a lot with other specialists.
Yes, I do. And I think it's super important for patients to be looked after, and then an integrative care is provided to the patients, and that they are looked after well from the conventional medical setting point of view. And everything is being done from the standard treatments point of view. And we just emphasize the importance of maybe having hyperbaric oxygen treatment if it is appropriate alongside the standard therapies.
I've got another question, Nur. Do you use treatment for yourself?
Yes, I do. So while I had quite a sort of intense treatment when I first started, obviously, because of my history of chronic concussion symptoms at the time when I started, and then I have repeated the course. Now I'm just trying to do once or twice a week. Every 1 year or 1.5 years, I do have more intense treatments. But yes, I try and do once or twice a week. Alongside I am very much into exercise, and I try and improve my exercise capacity. So I love exercising. And I find very useful alongside my exercise regimen and to improve my exercise capacity, but also I struggled a bit with exercise recovery for years. So hyperbaric oxygen therapy I find very useful, assisting me recovering from the post-exercise fatigue and the aches and pains. But obviously that it's important to do this alongside other lifestyle optimization measures. But yes, I'm very passionate and keen on hyperbaric oxygen therapy.
But I'm quite aware there are lots of people who are very keen on exercise, or professional athletes. Do they also go for hyperbaric?
Yes. There are some athletes attending, and professional and elite athletes, and for sure they come for the same reasons again. They come to help improving their exercise capacity further and also recovering from the exercises. There are not a huge number of studies done on that, and there was one Israeli study done on elite athletes, but there's not a huge amount of research. But the athletes attending, and they swear by it, they just essentially, there are some athletes, and they openly talk about this, that they do on a regular basis hyperbaric oxygen therapy before or after their matches, but also generally just sort of like to help themselves and to with exercise capacity. We do have quite a number of very healthy attendees, and then they come, they're preparing for triathlons, and they some again like very keen on exercise, and they follow certain protocols, and they embed hyperbaric oxygen therapy alongside their nutrition, exercise regimen, and optimizing their sleep, and looking after generally all aspects of their health.
Well, I can see why. And then they continue coming, because that has definitely been my humble experience of having had one treatment.
It's interesting that, as I said, even though there has to be more studies need to be conducted in the field for sure, but like some of these people, they obviously come and they're very they monitor every aspect of their sort of health. They monitor their heart rate and resting heart rate and REM sleep and deep sleep, and with either sort of Oura Ring or Apple Fit. And so you can clearly see how it helps reducing the resting heart rate. And then the majority of the patients, again, this shows that after starting hyperbaric oxygen therapy, especially the deep sleep, that improves on most people. And if they're monitoring their sleep already, they know what to expect. They know average what their deep sleep is. They know obviously what their heart rate is, resting heart rate is. And so they come and show me and as to how it improves. But it's just very important that every individual is different. And so it's very important for individuals to assess themselves and what it does offer or what it doesn't. Yeah.
That's amazing. I mean, exercise and sleep.
Absolutely.
These are so fundamental in one's well-being.
Absolutely.
And how HBOT supports this. You're saying that, a lot of people have positive experience. So, a lot of take-home messages from this.
Absolutely. It's an emerging field. Lots of studies come in, and then there are, as I told you, that there are sort of like 14 different FDA-approved conditions, and that list gets wider as the more research and studies being done. It is not the easiest field to conduct studies, and so it's important to realize that that when the studies are being conducted, and with the hyperbaric oxygen therapy, there are some intricacies involved in the research, and so so as you know, with the randomized control studies, and you have to include the treatment group, and then you have to include a sham group, and it's quite tricky to do sham treatments in hyperbaric oxygen settings, as sort of people would notice that whether you're pressurizing the chamber or not pressurizing the chamber. So, and also it just requires for patients to come on a number of days, having successive treatments, and it just requires quite a lot of time and effort. Therefore, it's not necessarily the research is not easy in the hyperbaric oxygen therapy, especially in the standards of randomized control standards. But there are still, a lot of studies come in, for sure.
Very exciting. Yeah. No, I'm also very interested in people who might be a bit worried about going into a monochamber.
Yes.
I mean, as a psychiatrist, obviously, I see lots of people who are anxious for all sorts of reasons, and people who have claustrophobia.
That's true.
So how accessible is this treatment for people who might be a bit worried about it?
Yes, well, we actually do have quite a lot of inquiries on just patients expressing their concerns about either their history of claustrophobia, and they just say, I can't do MRI scans, or I need to be sedated for MRI scans. Can I do this? I really would like to do hyperbaric oxygen, but I'm a bit claustrophobic. So I must say we really successfully treated a number of claustrophobic patients. And so I think it's just sort of a lot of the time the anxiety comes from the fact not knowing what hyperbaric oxygen therapy involves. So what we do, we obviously just give patients time. We take extra time with these patients. And essentially we just, we go through the process, and I explain each and every step, and starting from and sort of very beginning. So once the patients understand that there's equal amount of oxygen inside and outside, and the oxygen is delivered through mask, but they're not relying on the mask, and the mask is just there to treat the patient and deliver the oxygen effectively, but the amount of the oxygen inside and outside of the chamber is equal, and then the air inside is purified medical grade and filtered air, and there's a button inside, and I show patients that button, and that if they want to take themselves out, which they would never have to do this, and because there's always a chamber operator in the room anyway, we communicate with the patients at all times, so we monitor the patients at all times, and then it's a monochamber, so we can sort of. So unlike multi-seat chambers, when you go inside, you have to be treated with a group of patients together, so you can't necessarily stop the treatment in the midst of the treatment. But with the monochambers, it is the patient's space. So they can just change their mind, and they can just say, actually, I want to stop over here. And then we just decompress the chambers, we take them out. That doesn't happen at all, because as I said, we sort of like... go through each and every step, and with the patients we communicate throughout anyway. So, but also when they realize that they can press on the button, they can press on the button, and they can sort of release the door if they want to, and decompress the chamber. And I think that's a big relief for many people. And also I explain them that there's no lock involved at all. The door opens and closes through the pressure. So when there is pressure inside, obviously the door closes. When the chambers compress and then door opens automatically. So once the patients know about these facts, and they seem to relax, and then we had a couple of patients and they just said they're extremely claustrophobic, and then they just fell asleep, and after some time, and then sort of like it's very relaxing for them.
Absolutely. I think from a personal experience, having had the treatment recently, I can say the treatment itself is super relaxing, and after a while it's hard not to sleep. So that helps a lot. I think because it's kind of there is a window, you can so easily see outside.
See outside, yes.
Yeah. So you don't feel like, you're in a confined space as much. And also, the fact that you can hear everything going on outside, and you can talk to the chamber operator who's there all the time, checks how you're doing, and asks your permission at each step. I mean, for me, made it very comfortable. And also, I have to say, those tablet devices,
yes,
I put the relaxing music. I mean, it was a blissful experience. It was very, very relaxing. But I mean, what you're saying about, giving time and space for the patient, explaining everything, and asking for their permission at each stage, and not putting pressure to continue necessarily on that day with the treatment. I think they're all very important and makes it.
Absolutely. I think, as I said, once we establish these facts, and then they know that they can we go with their pace, and they don't have to start and finish the treatments of 60 minutes or 90 minutes, then I think it just puts people's mind at rest. And oxygen itself is very relaxing. And I mean, obviously you experience yourself as well. And I often just go into the chamber with just feeling very sort of enthusiastic about reading a book. But after like 20 minutes, I just like to close my eyes and rest. Often that's the case. So yeah, just generally, I think the patients do well.
Yeah. So hopefully this will convince patients who might be a little bit worried about trying it.
But they can just call, they can come and see the chambers prior to starting treatment for sure. So the chamber operators are extremely sort of experienced in this, and they know each and every step, and they take time and as much as the patient needs.
Well, thank you so much. It's wonderful to have this opportunity to have this chat with you, because I know you really well, and I know how dedicated and passionate you are on what you believe is right. So I'm sure in years to come you will be kind of making wonderful contributions to this field.
I hope so. Like, really, I do love every aspect of my job, and it's just we're all very passionate about hyperbaric oxygen medicine, and we're really excited about the future as well. And it is so rewarding to see patients that we contribute to their sort of recovery. It's very rewarding and very meaningful, I find. So I just feel very lucky to have to be in that position, sort of being a medical director of NUMA.
Wonderful. Thank you.
Thank you.